My name is Candice Ebert. I currently live in Regina, Saskatchewan. I am a licensed social worker in the Saskatchewan Health Authority. I work for mental health and addictions as a senior addiction counselor for the Regina Drug Treatment Court. Myself, I've been diagnosed with major depressive disorder. I was lucky that when I got my diagnosis, I was fairly well versed in depression, but our clients don't have that education. And so for them, it's, I don't feel right. Nothing's working. For the clients that I work with, sometimes there isn't a high level of cognitive ability. And so being able to break that down so that they understand this isn't something you've done wrong, you're not defective, there's a chemical imbalance and what that looks like, and explaining to them that if you're depressed, consuming alcohol is not going to make it better, it's going to make it worse, and putting it in those layman's terms for them. Accompanying them to their psychiatry appointments, because they can't always communicate what they need to. They can sit in an office with me and tell me what they're feeling, and then they get there and they freeze up. But they need answers and they need an understanding, and they get really frustrated, and then that leads to shame and feeling defective, and it leads to that hopelessness where they give up on themselves. So I think we need more education, not around just the stigma of mental health, but what is it? What are the effects of it? What are the symptoms of it? How is it going to affect you as an individual? And then what supports are out there for you? And there's lots of formal supports. I think mental health is more prevalent now than it has ever been. Loud and clear, I want people to hear that mental health and addiction does not discriminate. It can affect anyone. It can affect you at any point in time. We don't ask for it. We don't hope for it. But it's not just the people you would assume have it. It's your neighbors. It's your family member that's sitting in isolation telling you everything is okay when it's not. It's the person in your office that's going to work and going through difficulties at home and is consistently drinking or using drugs behind closed doors and showing up to work feeling shameful but putting on a mask. We need to have more compassion. We don't need to know what's going on, but we need to reduce the stigma by having more empathy in terms of, we don't need to know your story, but this could be your story, so I'm going to treat you as if it is. A single moment of being kind and giving your time and being compassionate can be a life or death situation. It can be the difference from somebody having that final straw that breaks it and they go home and they take their life, or they go home and overdose, or they're ready to make a change and then all of a sudden they have a negative experience of discrimination and they're like, what's the point? So those individual moments we have as we interact with everyday people are crucial. They're not just moments in passing. They can really impact the trajectory of somebody's life, and we can't just believe that it's only certain people that suffer with these things. Addiction and mental health do not discriminate. I want you to know that you can do this, and there is help and there is hope.